once again this morning, Dr. Kothary, the Chief Medical Officer for Dignity Health in the Central California Division, talking about the latest research and what's going on in Kern County with the pandemic. Dr. Kothary, thanks for being with us, sir. We appreciate it.
Absolutely. Thank you, Maddie.
So let's talk about the numbers that we just went over, the Kern County numbers. Yesterday, 50 new cases announced, 4 more deaths. And that is a significant increase over what we saw the day before and for several days before that. What do you think that indicates?
One of the things that is we have a lot more testing facilities in Kern County now. And a lot of these testing facilities, you can go and get tested without symptoms. And so I think we'll see a lot more positives come back because we already know that 25% of the people that are getting tested are going to be asymptomatic. So the numbers don't worry me as much. It's the numbers that end up in the hospital. That's what worries me. Okay.
And I think we have around 40 people in our local hospitals right now. And that's for all of Kern County. And that is the number that we heard County Administrative Officer Ryan Alsop yesterday saying that he thinks that the state should look at when it comes to criteria for reopening, because really that number of those who are hospitalized with very serious cases is a bigger indicator of how our county's doing with the pandemic. What do you think?
So I was involved in an initial call with Mr. Alsop and some of the supervisors in coming up with these new criteria. So I'm in complete agreement with this, and I don't believe we will ever be able to open if we just leave it up to the community and the number of cases positive in the community. It just wouldn't happen. We would have to have less than 90 cases in a 2-week period, which is very difficult to maintain.
Mm-hmm. So do you think that we're ready to move forward past phase 2 here in Kern County?
I do. I really do. And the biggest reason is we at the hospitals have capacity to bring in people if there is a surge. If any kind of surge occurs, we have ICU beds available at all of our Kern County hospitals. And so if we were to open and something bad happened, we could quickly close and take care of these people fast.
I mean, 40 people total who are being treated for COVID-19 here in Kern County in the hospital right now. It doesn't sound like that's anywhere near our capacity, or that we've ever gotten close to reaching capacity here in Kern.
No, and we've been extremely fortunate. We haven't, and so we have contingency plans to have a lot more people that if there was a surge to happen.
So you believe that our hospitals are prepared, which is great news. Another quick question I want to get to this morning. This morning, the Food and Drug Administration issued an alert about the Abbott Labs ID Now point-of-care test, the 15-minute test, saying that it could be giving inaccurate results in one study said for nearly 50% of samples. Another study said 15%. What do you think? Are you concerned about this specific test?
We do have some of these tests in our outpatient facilities. So it is a little concerning when you have something like that that's having such a false positive rate. And but majority of the hospitals, we're doing blood tests. So we don't have the Abbott ID at all.
So what kind of a test is the Abbott ID? Is that a swab test?
So Abbott, I apologize. So the Abbott ID is a finger prick. We're actually using swabs that are a lot more accurate. It's on a different Abbott platform.
Okay. All right. Gotcha. All right. Dr. Kothary, thanks so much for being with us this morning. Again, Dr. Kothary has been joining us during Sunrise. So if you have questions for him, feel free to send them to us here at 17 News, and we'll try to ask him. And we'll see you next week, Dr. Kothary. Thank you, sir.
Okay. Thank you.
We'll be right back after this.
Some people